So this abstract is a trial in progress abstract of a planned phase 1 and 2 clinical trial of recombinant intravenous interferon beta-1a in preventing toxicities after CD19 CAR T-cell therapy. A large fraction of patients undergoing CAR T-cell therapy experience cytokine release syndrome, or CRS, and neurotoxicity, or ICANS. And these toxicities lead to high morbidity, mortality, resource utilization, and also restrict patient access to these potentially life-saving therapies. Strategies such as prophylactic steroids or cytokine blockade-based agents have shown limited efficacy so far in preventing these toxicities, highlighting an urgent need to identify drugs or agents with distinct and novel mechanisms of action. Our group at the Hutchinson Cancer Center and others have demonstrated that CRS and ICANS are mediated by damage to the endothelium and blood-brain barrier. Interferon beta-1a is known to protect against damage to the endothelium and blood-brain barrier by upregulating the CD73 enzyme, and for example, is used in treatment of multiple sclerosis. We therefore believe that it's a promising approach to preventing CRS and ICANS after CAR T-cell therapy, and this would be a novel mechanism of action specifically aimed at improving the endothelium and blood-brain barrier. We plan to conduct a phase 1 and 2 clinical trial of intravenous interferon beta-1a and evaluate the safety, feasibility, and efficacy in preventing CRS and ICANS in patients undergoing CD19 CAR T-cell therapy. We plan to enroll 24 adults. Our primary objective would be to evaluate the safety of intravenous interferon beta-1a. Secondary objectives would be to reduce the rates and severity of CRS and ICANS, evaluate the anti-tumor efficacy of intravenous interferon beta-1a, and also reduce steroid usage. Exploratory and translational objectives would be to evaluate the in vivo effects of intravenous interferon beta-1a on CD73 expression and activity, endothelial function, the systemic cytokine milieu, and CAR T-cell function.